person to another, I think we need to be very cautious about those things because of liability. You know, if someone is not responding to that basic, you know, medication and they're still having shortness of breath, think about it this way. If someone can't talk, or, you know, they look like they're in distress or breathing really quickly, or they can't walk real well, this is a problem. It's only going to get worse. So, I mean, with asthma, we think about time, and so we think, okay, if we give the albuterol, if that doesn't work, then what? For you guys, we got to get them somewhere else. So, you know, if they're not able to walk or breathe or recover, and they look like they're in trouble, it might be calling 911, you know, or if someone's not responding and you're kind of saying, well, they look, I think they're okay, but I'm not totally sure, and your spider sense is going off, but you're not quite sure, you need to call the ambulance, then it might be getting them back towards town, or getting them out of the woods, or getting them back to an area where they can receive definitive care. Does that answer questions on asthma attacks at all? Anybody have questions on asthma? Yeah.
You know, if they are having a wheezing kind of attack, the first thing you want to lay down, you want to stand up, you want to
great question.
Around, you want to...
The first thing that you want to do is you want to help them try to be as calm as possible, because if you can't get enough air, it can be scary. So calm them, reassure them, and typically the most comfortable position is going to be to have them sitting up like this. It's going to help them fill the lungs with air more. So, you know, it's not uncommon to take, for patients, everybody's prescribed differently, take 1 to 2 puffs of albuterol, sitting up. And the other thing that we see sometimes too are panic attacks, where someone just really gets scared, and you know, maybe they fell, and maybe they kind of hit their solar plexus a little bit, or hit their belly a little bit, and they can't catch their breath, and they're freaked out. You know, in that type of situation, you know, give them a chance to recover, try to calm them, give them a few minutes to calm down. For a lot of kids, you know, and adults too, once they kind of get calm and get their feet underneath them after a few minutes, they start feeling a little bit better. But, you know, sometimes looking at the watch is helpful for you, because it can seem like hours, and you know it's been 1 minute, or 2 minutes, or 10 minutes. You know, I think if someone's not responding in the first couple of minutes with therapy, you're starting to get your awareness raised, and you're starting to think about what your next steps would be. You know, if you're getting to, you know, 3, 4, 5 minutes and not calming down, or if you're just like, this person looks horrible, it's never wrong to call 911. You know, we have 4 minutes to get, you know, oxygen. You know, and after we don't get oxygen for 4 minutes, we start to have issues with our brain. So, you know, asthma is something that can kill people quickly. So it's also super common. So give them that chance over the first few minutes, that initial treatment, get them calmed down. If they're not responding, then you need to get them to definitive care. Does that make sense? Yeah. Oh yeah.
Often I've had, you know, all of this happened to me before, and 10 minutes later I'm fine, and
yeah.
Hey, I'm feeling good, I can keep training, you know.
Yeah.
Okay, then maybe you should just...
So again, you know, you have to think about the vulnerable populations. Is this a kid? Is this someone who's vulnerable with other health issues, or is this someone who trains a lot, who's lived with asthma and is very experienced with it? And I think that that always kind of colors how you are going to treat a situation a little bit. You know, one of my sports medicine professors used to say, if you can't catch the person to like send them in, then they're probably doing okay. So, you know, if they're looking great, you know, then they're probably okay. Yeah. Well, if they don't have an inhaler with them, then, and they're having an asthma attack, then you have nothing to treat them with. You might do it briefly, but you know, if they're able to have a conversation like, yeah, I feel a little wheezy, I'm kind of short of breath, I don't know if they may have inhaler with them or not, you might be okay, but you want to watch them very closely. But if someone is having any significant symptoms, they can't exercise, they look like they're in trouble, they can't talk, I mean, I think you got to think about getting them to that inhaler as quickly as possible. And if it's like, I need to walk 50 feet to my car, then maybe go with them to their car and get the inhaler and do some puffs of albuterol. They're like, if they can't speak and they're turning blue, you don't have anything to do, you're calling 911. Yeah, good question.
And then it's just really important to stay calm.
Absolutely.
And then maybe put a hand on their back and really use your instincts on what to do.
That is such a great point. And so a lot of times I'll approach people and say, look, you know, we're going to take good care of you. If someone's really struggling, we're going to take good care of you. We're going to help you. We're going to stick with you. We're going to get you through that to help them calm down and feel reassured. And I think with any injury, that's a great point here to make sure that you're doing that. The other thing is if something is happening and you're getting freaked out and you're like, oh my gosh, what's going on? I want you to stop, take a couple breaths yourself, and before you go rush and do something, think about it, look at what's going on, and try to, you know, get a sense, because, you know, as a leader, you're kind of the calm one and need to do an assessment of the situation. So, sound good, guys? So that's a great one with asthma. These things and allergies, I would just kind of put in the same category. And allergies take form in a lot of different ways. So sometimes people will get, you know, allergies to, you know, just being around plants or different things. Mark Bixby was saying you get bit by a mosquito, you know, you get a little welt, that's an allergy. So there's allergies that are very minor. The allergies that we get the most concerned about as being emergency would be anaphylaxis. So with anaphylaxis, it's a condition that affects the whole body quickly. And one of the most common ones would be bee stings. But some people certainly get those to other foods too. Some people might have a peanut allergy or an allergy to avocados or any number of things. And so what starts happening in that situation is they get a rash that starts spreading quickly across the whole body, possibly. They might get swelling of the lips or tongue. They might get wheezing or have a breathing issue. And definitive treatment for that would be, again, this person may have medication, and if so, if they carry an EpiPen with them, and a bee stings them and their face starts swelling up, they start getting splotchy and wheezy or concerned, you might help them make sure that they can administer that medication themselves. And then what I would say with that is that I think it's a really good idea after medication is administered for that patient to be monitored in some way, and for you to hand off that patient to someone else, because there's always the risk that that medication wears off and they can have a rebound of symptoms. So if they have one dose of epinephrine, which they are trained to administer, you probably aren't going to be working out the rest of the day, or it's probably not a good policy for you guys to be in charge of someone working out the rest of the day in that situation. So that's where I would kind of be terminating the workout for them and getting them back into their parents, or saying, you know, look, why don't you take it easy today, come back, you know, after talking to your doctor, or come back after we make sure you're good for a day. Because I think some patients might be okay after administering that shot, but some aren't. And you don't probably want to be in that situation where they need another dose and you don't have it. So, you know, I think it's a handoff, or if they're on an overnight trip or something, a phone call. If they take the medication and they respond and they're doing really well, you know, then it, you know, like I said, a call or a discussion. If they're not responding or they don't have a medication and someone's lips starting to swell, you've got to get them to the hospital ASAP. And the quickest way in the Twin Cities is 911. Because again, they can quickly lose their airway and not be able to breathe if they get swelling of the lips or tongue. And that's the situation that we worry about. So that can truly be an emergency, and it's a good one to know, because you don't have time to mess around with it when it's bad. Does that make sense with anaphylaxis, or any other points or thoughts? Yeah?
What if they can administer what is it,
Coaches, do you guys have a policy on administering medications? Typically, you know, I know for the medical folks, if you don't have a medical license, that you shouldn't be administering medications for other people.
I would think Mark would say no.
Yeah.
Yeah, it's no.
If they're gonna
Yeah.
die, stick them with the damn EpiPen.
Yeah. Yeah, I think the answer is no. So,
But they're in shock, entry shock. If they're gonna die, stick with what they did. Huh? They're gonna die.
Do you know how to use it? So how do you know you're going to use it correctly?
Exactly. That's what I